Don't change your answer. Trust yourself. If you're unsure, whatever you picked before, just leave it there. So welcome back to the channel. If you are new, my name is Andy, and I just want to tell you something. It is lovely over here, okay? Consider subscribing and turn on your notification bell so that whenever we have a video, you'll be among the first people to know. In today's video, we're going to talk about test taking strategies. I have about 5 of them for you guys today. So make sure that you watch this video to the end. I promise it's gonna help you. This is how I managed to pass all my board exams, my NCLEX, I nailed it once, my even CN, I nailed it once, NCLEX-RN, I nailed it once, NCLEX-RN, nailed it once, NP boards, I nailed it once. This is not me bragging, it's just me sharing my test taking strategies with you so that you can nail it once. And if you don't nail it once, it's okay. You'll nail it the next time, okay? When it comes to NCLEX or any board exams that you want to take, the number one thing is that you have to read the question very, very carefully and thoroughly. It's essential. When you're answering your questions, make sure that you're actually answering the question that is being asked, not what you think is being asked. It happens to me where I'll read something and I'm thinking this is what they asked, and I have to go back. I'm like, hold on. And then you see that that's not actually what was asked. So don't rush. Make sure that you're actually answering what was asked and not what you think in your head. Our mind processes things faster. Even when you're typing, as you're thinking in your mind, you're typing, and sometimes you make mistakes because your mind is processing it faster than your hand can type. Make sure that you're using the process of elimination. Narrow down your answer. There are answers that are always like off. Make sure that you narrow down your answers, and then you have a set of ones that are most likely the correct answer, and then you can now drop them off as you process those answers. So narrow down your answers as you focus on the most likely correct answer. So if you're unsure of the answer, don't panic, okay? Go back and read the question again. Use your critical thinking skills, because in nursing you have to be able to think fast. Use your critical thinking skills. Think of that patient's diagnosis. What would be the best outcome for that patient? What is the best thing that you can do for that patient? What would be the best nursing intervention for that patient? That's how you narrow down to the right answer. Don't panic. Just think about it and answer the question appropriately. So that is just like a general overview of what you should do, what you should have in your mind when you're going to your exams room. Now, when you have the question right in front of you, remember your ABCs, right? What is ABCs? Is your airway, is your breathing, is your circulation. That airway is number one. Someone's gotta breathe, okay? That's important. Are they breathing well? What about the blood flow in their body? So you wanna make sure that you're going in that category. Especially when you're dealing with a question that you have to prioritize. When they ask you, okay, what is the most important thing you should do for this patient? What is the important step? What is the next step? What would be the most beneficial for this patient? Make sure that you're using your ABCs. You will not go wrong. Another acronym that you should get used to is what is called ADPI. ADPI is assessment, diagnosis, plan, intervention, evaluation. That's another tool that you should get familiar with, that is really, really important. When you do your assessment, okay, then it's gonna take you to like, okay, based on my assessment, okay, what do they likely have going on? So that will be your diagnosis, okay? And then your plan. So what am I gonna do? Now, okay, I've assessed them. I think this is what's going on. What is my plan? Okay, the next thing, okay, you got a plan, so you're going to put your plan to work. That's your intervention or implementation. And then when you finish that, you're going to evaluate. So you're going to go back and reassess, evaluate, and make sure that what your plan was actually worked. Another thing you should think of is Maslow's hierarchy of needs. Everybody, human being, has basic needs. So what would be, again, it goes back to your ABCs, the same thing. What would be your best intervention? What would be the best outcome for this patient right now? So that would most likely be the correct answer. Pay attention to strategic keywords, okay? With NCLEX, you gotta pay attention to strategic keywords like priority, most likely, initial, best, those kind of keywords. You should trigger something in your mind like, okay, this is what they're looking for. Say for example, your patient has just been brought back to the unit after undergoing a cardiac stent procedure. Which observation would be the best priority for this patient? And let's say your options, your answers are A, level of consciousness, B, blood pressure, C, status of airway, D, oxygen flow rate. So using ABC, how would you eliminate the options to get to the right answer? I'll give you the answer at the end of the video. So think about that. And at this moment, while you're watching this video, I want you to put your answer. Don't wait till the end of the video. Type in your answer right now. As you're watching the video, type in what your correct answer is. And I'm going to leave the question on the video so that you think about it. Type it in. I'll tell you the answer at the end of the video. Also remember that as you transition into a nurse, whether you're already working as a nurse or you're about to take your NCLEX, remember that you're now going to be delegating. You're in another level now. So you're going to be delegating tasks for other people. So make sure you know what to delegate to, someone, right? So let's say a CNA. What are the things that you can delegate to a nursing assistant or a carer? What are the tasks that you can delegate to housekeeping? What are the tasks that you can delegate to, say, activity assistants? You are in a different role. You're going to be delegating tasks. So make sure you know each person's role. So because you're going to have questions like that. You're going to be practicing as a registered nurse who is licensed. You have to know what the scope of practice is for your license. For example, a nursing assistant or a carer can help take the patient to the bathroom. They can help provide water. They can give the patient their bath. And compared to an LPN can, a licensed practical nurse can, give medication to the patient. They can check blood pressure. Even a nursing assistant can check blood pressure. But an LPN can assess the patient lung sounds. They can also help with wound care for the patient. So making sure that you know what task belongs to who so that you can delegate appropriately based on your scope of practice. Finally, don't change your answer. That first choice is always correct. So that has happened to me. It has happened to a lot of people where they change their answer and then only to find out that first answer was the correct one. If there was a reason you chose that answer. So just trust yourself. Trust yourself. Why were you drawn to that answer in the first place? So trust yourself, use the process of elimination, and just leave it alone. So my answer for the previous question was status of airway. Remember your ABCs: airway, breathing, circulation. First of all, they can't breathe if the airway is not clear, okay? You want to make sure that the status of the airway is good, okay? Well, if the status of the airway is good, trust me, your oxygen flow rate is good. You see what I did there? Because how can you go check your oxygen flow rate if the airway is not even right? Because you're not going to get nothing. But if your airway is good, your oxygen flow rate is going to be good. Your blood pressure is going to be good because it all ties down to, ties together, okay? Just FYI, we are going live February 3rd. It's a Saturday. It's going to be a Q&A chit-chat session. So bring your questions. If you have any questions that day, bring your question. It is our 2K subs giveaway. It is my way of saying thank you for every amazing subscribers to my channel. You are just awesome. So come hang out with me Saturday, February 3rd. I'm going to do a giveaway, so someone is going to win an Amazon gift card. And I'm also going to give a pocket primary care handbook out. So if you are interested in this pocket notebook, it's a great resource, with very helpful for RNs too. So like when you have a new patient, so it goes into different sections: cardiology, dermatology, general medicine, GI, hematology. Like it's a great resource. So if you would like to win this book, please come. And if you're looking to take NCLEX, if you're one of those that are taking NCLEX, I have a surprise gift for you that day. I'm not going to say it today, but I have a surprise gift. So make sure you show up too. The only unfortunate part is that if you're winning any book, it has to be within the US in order for me to be able to mail it out for you. So if you're going to win this book, it has to be someone, unfortunately, in the US. But Amazon gift card can be anyone, okay? Anywhere in the world, you can win Amazon gift card and you can buy whatever you want to buy. Anyway, that's all I have for you guys today. Until my next video, I hope to see you on the 3rd of February at 2 p.m. Eastern Time. I love you with the love of God. Bye.